Hello, good afternoon. I'm Dr. Krishnaveni. I'm currently working as a Consultant Obstetrician Gynaecologist at Yashoda High-Tech City Hospital. I'm here to talk to you people about Polycystic Ovarian Syndrome. This is a very common problem a lot of women face in and out every day. And this problem is like the occurrence is about out of 100 women, 25 women will have this problem. And this is one of the most commonest gynecological problem we see in India. This is a condition where it affects the periods of the woman, and it also affects how the woman looks, that is the appearance of the woman, and it also affects her fertility and also affects the long-term health. The polycystic ovaries are slightly larger than the normal ovaries, and they contain lot of fluid-filled spaces in them. These are called the multifolliculated cysts. So these cysts are around more than 10 in number in each ovary, and the ovarian volume also is increased in the polycystic ovaries. So, women can present with the period irregularity. That means that women may not have a period for 3 to 6 months or sometimes more than a year. Or they may have like very frequent periods. Or there may not be no period at all. Or sometimes they may present to us with the problems with their appearance. So, sometimes they may be excessively putting on their weight, or they can be overweight, or sometimes they will be having difficulties in losing the weight because of this polycystic ovarian syndrome. And also sometimes they present with acne, and also they can present with the extra hair over the face, chin, and they may also present with the issues with getting the pregnancy, that is the fertility issues. And sometimes, rarely, because they have the problems with their appearance, these women tend to present to us with a history of depression, feeling low. As you all are aware that this polycystic ovarian syndrome is a very common problem, but we do not know exactly what causes this condition. And most of the time, this runs in families. That means that if the woman has this condition, it's more likely her family members like her daughter or her sisters or mother would have had this condition. And most of the time, what happens in this condition is they have abnormal hormone levels. So there is one important hormone called the testosterone. This is actually produced in all the women in the small quantities by the ovaries. And in the polycystic ovarian syndrome, this is produced in larger amounts, and this is the hormone that causes the effects of the extra hair over the body and irregularities of the period and difficulties in getting the pregnancy. And the other hormone is the insulin, and this is one of the hormones that controls the metabolism of the glucose, and obviously the body is not responding to the insulin. That is called insulin resistance. This happens very frequently in women with the polycystic ovaries. And if they have more amount of the insulin resistance, their body is trying to produce more and more amount of the hormone to get this glucose metabolism going on. But sometimes the insulin is produced in such a large amounts that again impacts the irregularity of the period and the difficulties in getting the pregnancy and increased appetite. And because of this, the woman tends to have more and more diet, and this results in the obesity. So mainly we diagnose this condition with the symptoms, that is like the period irregularity, or sometimes with the history of the appearance, that is they have the acne and the extra hair over the body, or sometimes with the abnormal hormone levels, that is the testosterone and the insulin hormone levels. And also we do the scan for these patients whom we are suspecting the polycystic ovarian syndrome. And in the ultrasound, we see what is known as the polycystic ovaries. So out of all these 3 criteria, women should have 2 criteria, then we diagnose them as having polycystic ovarian syndrome. It doesn't mean that the woman who has the polycystic ovaries will definitely have the polycystic ovarian syndrome. It is a part of the syndrome, having the polycystic ovaries. So if the woman have the polycystic ovarian syndrome, as we discussed, she will have the problems with getting the irregularity of the periods, and also on the long-term health, they can have the diabetes in the future because they have increased insulin resistance. They tend to develop the diabetes during the pregnancy, that is called gestational diabetes, or once woman reaches their 40s or 50 years of age, they start developing the diabetes. Hence, the women who are diagnosed with the polycystic ovaries, they have to take the precautions. They have to make sure they do the diet and exercise regularly so that they can prevent this diabetes problem for them in the future. And other important thing is they tend to develop hypertension later on in their life. The reason behind it is because of the insulin resistance, they actually gain more weight, and because of increased weight, it causes the hypertension rather than the polycystic ovarian problem alone. And some women with this polycystic ovarian syndrome may have cancer later in their life, like the endometrial cancer. That is nothing but the cancer of the lining of the womb. So what happens is, because if she is having the irregularity of the periods, the lining of the womb becomes thicker, and when it becomes thicker and when it is not shed every month, that can result in the future the endometrial cancer. And another common problem which we are facing nowadays is, as women is having this polycystic ovarian syndrome and they have the problems with their appearance and they think quite a lot about it, and they start developing the problems with the depression and anxiety. And also some women, because of the overweight, they develop the problems like sleep apnea. Basic important step to reduce these long-term effects of the polycystic ovarian syndrome on the health of the woman is the diet and the exercise. So it's important that we have to take a balanced diet, and obviously it is very important that we try to avoid the carbohydrate diet and as well as the sugary diet, sweets, and we have to go for more millet-based diet and have the diet that involves wheat and also lot of fruits and lot of vegetables. And exercise, that is another key for reducing the long-term effect of this polycystic ovarian syndrome. It's very important that woman at least does 30 to 40 minutes of exercise at least 3 to 4 times in a week. And this will help to reduce her weight and also the insulin resistance, and this will help to avoid the long-term problems of polycystic ovarian syndrome. And other important thing is they have to come for regular health checkups, like they should have the diabetes problem checked at least once a year, and also if they are not getting the period regularly, they need to see the gynecologist if they have not seen the period beyond 3 months. So it's very essential that women should have the period at least once in 3 months to avoid the cancer of the lining of the womb in the future. And also if they are having the problems with the depression, then they have to visit the psychologist for the counseling. And if they have the problems with the sleep apnea, then it is better they could visit the physician. So obviously by taking proper precautions and proper treatment, this condition could be treated. And it doesn't mean that this condition completely get treated all the time. There are phases in the life where the condition is under control when the woman is taking good diet and good exercise. And once the woman is not maintaining her body mass index, and if she's taking more amount of the diet, or if she's putting on more weight, then she will show the symptoms of the polycystic ovarian syndrome at that stage. Thank you.